I'm Shivlal Pandey. I am a resident physician at Louisiana State University's Monroe residency program and a research collaborator at Mayo Clinic, Rochester. I'm here at ASH 2013 meeting to present the work on impact of fish abnormalities on response to lenalidomide therapy in patients with multiple myeloma. For this, we elected to study patients on lenalidomide therapy, as this is one of the most common therapies that is used as initial line of therapy in patients with multiple myeloma. We examined a cohort of 518 patients who were started on lenalidomide therapy and in whom FISH results was available. These patients were divided into two categories depending on the FISH abnormalities. It was either a trisomy or a translocation. Patients who had been started with bortezomib and lenalidomide as a combination were excluded from the study. The results showed that translocation was prevalent in 30% of our cohort, whereas it was 62% of trisomies. A PR or better response was seen in 80% of patients with trisomies, while 63% showed PR or better response in the translocation group. The time to next therapy in patients with trisomies was 28 months, while the same was 17 months in patients with translocation group. The current data supports the hypothesis that the underlying primary genetic abnormality can affect the response to a particular therapy. In this study, response to lenalidomide was better in the trisomy group as compared to translocation group. Based on our study, newly diagnosed patients with trisomy abnormality on FISH could be considered for lenalidomide-based therapies like lenalidomide and a low-dose dexamethasone. Additional studies are needed to examine if patients with translocation would benefit from therapies like bortezomib. This would allow development of therapies that are specific to the genetic abnormality of different patients and would reduce cost and toxicity in different patients.